This is the temporomandibular joint here. The mandible is this bone that is extracted away from the head when the jaw is opened. So the temporomandibular joint comprises of two temporal bones here, which are attached and part of the vault of the cranium, and the one mandible on the bottom. So one of the bigger picture reasons why someone might need to have this type of TMJ therapy and intraoral work is to reduce compression of the joint. All joints that are subject to overuse or overcompression because of, say, too much clenching or grinding, say, that's oriented to one side perhaps, or even bilaterally with the TMJ, would be subject to osteoarthritis over time. So basically the movements are causing some kind of erosion to that disc that actually protects the cartilaginous portions of the upper portion of the TMJ here and the condyles of the mandible. So what you want to do is have less compression in the jaw joint as you open and close it. If an individual tends to chew on something, for example, their fingernails, or biting down on a pencil or the ends of pencils, say like students do, what you would find is that the jaw would protrude like this. And so you would have extra kind of strain on the actual disc. Some other dysfunction that can happen with the jaw is that the jaw itself can actually go retro. It can actually become more receded, the mandible portion of the TMJ. That can be posture related, but it can also be related to mouth breathers. For example, people who are suffering from any kind of sinus congestion in through here where they can't breathe. They find that at nighttime when they're sleeping or during the day they need to keep their mouth open. So what happens is the tongue actually, rather than its normal positioning, which is resting on the top of the roof of the mouth, the tongue actually rests on the bottom of the mouth, not to obstruct air coming through the mouth into the trachea. In the Feldenkrais method, we often look at the use of moving our extremities from our core, and that stands true with the TMJ as well. For example, what we tend to do when we're talking and eating and things is we're extracting the mandible away from the head. You wanted to re-educate the relationship between your jaw and your head and neck and posture. We're not used to using our head to open our jaw as much as we are using the muscles to extract the mandible away from the head. Say, for example, if you were going to bite into something very big, like an apple, for example, then it helps to re-educate your body to think, well, I'm opening my jaw, but at the same time I have a relationship with my head and with the back of my neck. You've had maybe some problems with your dental work, perhaps you've had some oral surgery and you've had some problems with certain teeth or sensitivities to teeth that create an asymmetry in your mouth while you're chewing food. For example, maybe you've got a tooth that is sore or a tooth that is broken off or something, so you're chewing on the other side. Now, if these things are temporary, that's fine, but if you've got like a hot and cold sensitive teeth, one tends not to sort of put hot food or things like that into that area, so it can create an asymmetry with the use of the jaw and chewing. For example, if the jaw was having a tendency to track over towards the left and then pull back to the right, well, then we might want to work on the muscles that could balance that so that we could get that tracking more easily back over to the right. And so therefore, once the muscles were balanced, we would be able to have the jaw joint open directly up and down. A glove like this, just like you would have a dentist or someone and using this to work into someone's jaw joint and actually release the tension in their TMJ. What we call intraoral techniques, one would sit either at the head of the table or lateral to the patient of the side that you were working on, and have the person open their jaw. I would actually work in their jaw on one side and the other side to balance the muscles on both sides. And just to understand the mechanism, this is a gliding and a hinge joint, so it hinges as well as glides forward in order to fully open the jaw. Now, the muscles that are most affected in jaw joint mechanics are the medial and lateral pterygoid muscles, the temporalis muscles, as well as the masseter, which runs from here to here, and also the digastric muscles, which run underneath the chin. So all of those, as you can see, would help to execute opening and closing of the jaw, as well as lateral movements of the jaw, like grinding. If the jaw is being dragged to one side, loosening up those muscles would allow it to come back into a more normal functioning jaw. Here we have a myofascial trigger point chart that actually indicates the muscles of mastication, we call them. And as I noted before, lateral pterygoid, which is here, the masseter muscle, the medial pterygoid here, and the temporalis muscles here are all instrumental in opening and closing your jaw and doing lateral movements, as well as the digastric muscles underneath the jaw here also aid in opening the jaw and closing the jaw. Colored portions here show radiating pain patterns. So, for example, if you had trigger points or muscular tightness in your masseter muscle here, you could feel pain in anywhere of this green section here, up into the head, up into the forehead, behind the eye, radiating into the chin, and being just in the side of the jaw. The pain pattern for the lateral pterygoid is here just across the zygomatic arch and in the front of the cheekbone, as well as close to the ear. Temporalis muscle could also radiate pain into the temporal area as well as up above the teeth. Often people get radiating pain in behind the eye as well from TMJ problems. Also, some other muscles that are connected are the sternocleidomastoid muscle, which is here. These muscles are very commonly worked on by massage therapists because when you release that, you can obviously see this pain pattern radiating into here that you can actually alleviate that pain. So I'll just show you how we actually access those muscles within the jaw and what you can do about your TMJ discomfort. And just to finish up, so during a temporomandibular joint session with someone, I would assess their TMJ, how they're opening, how they're closing their jaw, take a case history, find out what the history of any kind of dental work that they'd been having. If they had had oral surgery, if their muscles were in spasm, we would be able to deal with that effectively with this intraoral work. Loosen up the muscles that were tight, re-educate the jaw mechanics of opening and closing through some of these exercises that I've gone through, as well as do some work on the neck and shoulder region which would be working on the auxiliary muscles that actually facilitate some movement with the TMJ as well. So we would use sort of like a pinching technique to actually squeeze and release the tension and trigger points out of that muscle, as well as working back here with the splenius capitis and some of the other suboccipital muscles to just create space between the occiput at the back of the skull and the first cervical vertebrae. Once someone has this treatment, they feel in some ways like it's almost like a non-surgical facelift. If they're carrying a lot of tension in the jaw, there is so much relief, it's hard to explain. And it's quite easy to do. We can do that effectively in a 1-hour treatment, and we can recommend how many sessions that we think that it will take in order to balance someone's jaw.